Thank you very much, folks. For those of you who don't know me, I'm a retired school principal, and we know what we call wait time when we call a class to order. We just wait. Anyway, good morning and welcome this morning to our Government Affairs Forum, sponsored by the Gresham Chamber of Commerce. My name is Bob McDonald. I'm serving as the interim executive director for the Gresham Chamber. And I welcome each of you this morning to our forum. I want to especially express thanks to our sponsors who sponsor this event. Our presenting sponsor is Riverview Community Bank. And I don't know if Larry is here this morning or not. I understand Larry just got back last night from Maui, I think. Maybe that's why he's not here. Also want to thank our supporting sponsors, which is the Gresham Barlow School District and Portland General Electric. Without sponsors such as this, we would not be able to have these forums on a monthly basis. So we appreciate their support in helping to enrich our community. We have a few political leaders here this morning, elected leaders. I believe Michael McCormick from Gresham City Council is here. Michael, I know I saw, there you are over there. Lori Stegman, I know I saw Lori. There's Lori over there. Is there anybody else from Gresham City Council? There were a couple others that signed up, but I don't believe they have made it. I want to also welcome Mayor Ted Tosterud from Fairview. Mayor, welcome this morning.
Good job on the last name.
Oh, thank you. I just met him yesterday, so I guess I'm doing all right. Well, we appreciate our sponsors. We appreciate our political leaders who continue to support our forums. And at this point in time now, I want to welcome Warner Allen, who is the chairperson for our Gresham Government Affairs Committee. Warner will introduce our speaker.
Thank you, Bob. Thanks again for serving as our interim. As he said, part of his shoulder is back in place after us twisting it out, convincing him to assume that role. Welcome everybody for our first forum of the new year, 2015. Trust everyone had a happy new year. And it's particularly my pleasure to welcome Deborah Kafoury to our first forum. And of course, she's brought her excellent staff with her. You know, in the Willamette Week article on March 28th of 2014, where they were outlining the race for county chair between Mr. Francis Cody and Deborah Kafoury, they noted that Multnomah County government is like plumbing. Essential, but only noticed when there's a mess. Deborah Kafoury is with us today, marking 7 months since she was sworn in to lead Multnomah County, and we're pleased to say that she's not here to discuss the county is in a mess, but rather discuss with us reflections, accomplishments, and challenges she's faced since taking the helm and issues and topics specific to East Multnomah County. Deborah was born in Walla Walla, Washington, came to Portland, graduated from Grand High School, then returned to Walla Walla to attend Whitman College. Thereafter, she served as an aide and advisor to Congressman Les Aucoin. In '98, Deborah was elected to the Oregon legislature, served 3 terms in the House, serving as the House Democratic leader at age 34, the youngest person to ever do that in Oregon history. Deborah was first elected to Multnomah County in its commission in 2008, re-elected again in 2012. Where she served as on the county's audit commission, co-chaired the domestic violence review committee, and beat the drums to ensure that the Selwood Bridge project went forward. It should also be noted that in April 2008, Willamette Week once again featured Deborah in an article in which they asked her what tattoos she would get, and she commented that she was going to be the last person remaining on Earth to have a tattoo. With all that said, please welcome Multnomah County Chair Deborah Kafoury, who will introduce the panel of county personnel who will be addressing us. Thank you.
And I still do not have a tattoo. And hopefully I'm trying to convince my children that's not a direction they want to head either, but we'll knock on wood. Thank you so much for having me here today. It's a pleasure to be back. Last time I was here with you, you may remember, I was campaigning for the job. And I made a commitment then that if elected, I would be chair for all of Multnomah County and not just downtown Portland. And I intend to make good on that pledge. So over the last few months, I've been meeting with mayors and police chiefs, business owners, school superintendents, faith leaders, nonprofit executives, and residents. And again, I hear from people in our community that they need Multnomah County to have a strong presence, to be an active partner in East County. And that's my goal. Since taking office 7 months ago, I've been looking at immediate changes that I can make, like making sure we're paying our employees at Multnomah County a livable $15 an hour wage. And I've been looking at projects that will take longer, like helping families move from homelessness to housing and increasing access to mental health treatment, which are two of my top priorities. A stable home is the foundation of a stable life. Yet right now, more than 1,700 people sleep on our sidewalks every night. And last year, more than 3,000 school-aged children experienced homelessness. I'm determined to make lasting change for these families. Under my leadership, the cities of Portland and Gresham, along with Multnomah County and the Housing Authority, have come together to form a shared governance on homelessness. Removing bureaucratic roadblocks allows us to share information and resources. And as chair of this committee, I've asked the coordinating committee to develop an action plan on how to reduce the affordable housing gap and help people who are experiencing homelessness get off the streets. We will be implementing this plan in the spring. I'm also hearing a lot about mental health from people that I talk to in our community. Mental health, we know, is so intrinsically tied to stable housing and steady employment. And in response, at Multnomah County, we've been building out our mental health first aid program. We are supporting the development of a suicide prevention campaign, and we are providing programs for people with mental illness who come in contact with the criminal justice system. Since Multnomah County's budget, finally, is on solid financial footing, we have a unique opportunity. We can begin to focus on preventing problems before they occur. And one topic that I think you'll agree with me that needs more attention is the prevention of youth violence. I took office in June, and less than 2 weeks later, a young man, the tragedy, still hard for me to talk about, tragedy at Reynolds High School occurred with a 14-year-old boy being killed and then the shooter killing himself. And I'm really proud of the work that Multnomah County's law enforcement and our county mental health professionals did to help students and families cope with this senseless tragedy. And I plan on continuing to work with our law enforcement agencies to help officers get the training and the resources they need to effectively manage people who are struggling with mental illness. And I'm looking at ways to get more mental health resources and counselors into our public schools. I have 3 kids. I talk about them a lot. They're a big part of my life. But they have a lot of privileges. When I look at them, I also see there are many children in our community who don't have those same privileges. And today, one of our speakers is Joe McFerrin, who's the president and CEO of Portland Opportunities Industrialization Center. I just call it POIC because I can't say those words. And he's an ardent advocate for kids who face adversity. Multnomah County is developing stronger partnerships with organizations like his to make sure that kids get the services and the mentorship they need to make the right choices in their lives. Speaking of kids, I've started talking with mayors and city councilors in Multnomah County about how to reduce youth access to tobacco and e-cigarettes. I recently learned that my 9-year-old daughter can legally buy and use e-cigarettes, and that nicotine might be the least harmful chemical in those products, but we don't know because they are entirely unregulated. What we do know is that no one person, no one agency, and no one government can do anything alone. We're here at Multnomah County to work with you so that you can develop a strong economy, raise healthy kids, and employ our residents. When we develop these strong partnerships, things change for the better, faster. I brought with me today a team of leaders from various Multnomah County departments who can talk more in detail about housing, mental health, youth programs, and e-cigarettes. And I'm happy to have them here today, and I look forward to this continued discussion. And because we are having this show taped for television, I would appreciate if each person, when they talk, can come up to the microphone so we can get it for our viewers on TV land. First off, we have Jim Hayden. He's the Deputy DA for Multnomah County, and he's a newly appointed prosecutor focusing on East County. Then we'll have Rebecca Stavanger to talk about Sun Schools and our joint Promise Zone application. We'll then turn it over to Joe McFerrin, who's the president of POIC at Rosemary Anderson High School. He'll talk about a capstone project for alternative education in East County. David Hidalgo is director of Multnomah County's Mental Health and Addiction Services, and he'll discuss the intersection between behavioral health and social services. And last but not least, Joanne Fuller is director of Multnomah County's Health Department. She'll talk about programs, clinics, and healthcare transformation. And then we'll open up to questions from the audience. Thank you so much.
Good afternoon. My name is Jim Hayden. I'm a senior deputy district attorney for Multnomah County, and I am here to talk to you about really what Multnomah County is trying to do at the DA's office out in the Gresham, Rockwood area. So I don't really know how long I have. I'm going to look at the speakers out here. So 6 minutes. I'm going to go fast. That's okay. We have had a what we call a neighborhood DA, a neighborhood-based deputy district attorney in Gresham for many years. The neighborhood DA program you may be familiar with started. Previous attorney Mike Shrunk started this in about 1990, and it really has become a national model. The idea of taking prosecutors out of the courthouse and putting them in the community where they work directly with the police and with the community trying to solve the problems. And they usually result in neighborhood-based problems, street crime, problems in neighborhoods, and we have really pioneered that way of removing prosecutors from the courthouse. But one thing that we recognize is that we've done that, we've done that very well, we think, in Portland, and we've had a Gresham prosecutor out here for some time. But we noticed several years ago the intersection of really more and more of gang and violent crime and street life and livability. And there is an area, and we began to focus some particular resources in an area of Portland around Albina and Killingsworth. And the reason that we did that was we were partnering with the community there, strong business community, Portland Police Bureau, and we became a part of a plan there to try to curb violence around Albina and Killingsworth. In fact, we've done a very good job of doing that until the recent shootings, unfortunately, near Rosemary Anderson High School. Joe may touch upon, and that's unfortunate, but it's been very crime, not I'm going to say crime-free, but crime has been greatly reduced there for many years. And we thought to ourselves, if we can have that kind of success there, what are we doing further east? Have we made the proper commitment in the Gresham area, and particularly the Rockwood area, where we're seeing the gang crime rise? We all know that gang crime is on the rise in the Rockwood area, and why. There's a lot of people that could probably give you reasons why, and I've heard many of them. The Max running right out to the area, the fact that you've got gentrification in some of the neighborhoods in north and northeast Portland. That may all be true. Nonetheless, the fact is, violent gang crime has been on the rise. And so our idea was to take some of the strategic ideas we've had and used over in those areas of Portland, particularly what came out of Albina and Killingsworth, and see if we can move that into the Rockwood area. So our idea, not quite, but almost 2 years ago, we partnered a little bit with the Rosewood Initiative, and we came up with a group that we call RENEW, the Rosewood Rockwood Enrichment Neighborhood Enforcement Work Group, RENEW. So there's a guy that on my team I work with that loves acronyms, and so he had to find an acronym that fit RENEW, and that's what he came up with. It's not that. And so RENEW has been partnering with the community and law enforcement, trying to bring together a lot of various agencies and talk about what's good in Rockwood and how can we make it better. We thought we can do more, and we can do more particularly from a law enforcement perspective, and that's when the district attorney, Rod Underhill, and I discussed, well, how can we use smarter prosecution to come out in that area and see if we can get a better handle on some of the violence and gang crime. Now, the idea was never, and is not now, to come out here and try to suppress crime. The idea is to try to work through RENEW collaboratively with the community, but at the same time recognize that there are some more violent and dangerous actors that we need to deal with on a more serious basis and try to find out who are they. And the best way to do that, we've decided, is to use smarter prosecution and policing strategies. And mostly by that, what I mean is we are partnering with an excellent East Metro gang enforcement team and resources from the East Precinct, and taking their subjective information, and we're combining that with what we know about crime in the area and trying to look at risk factors of people that are out there. Really, who we're after are the players. Who are the players and who's driving crime in the area? And we want to combine what we know with what certain statistics tell us, and we want to put the two together, and rather than wait for certain crimes to occur and react to them, which we will do, and the police do a very good job of, and we have to do that because we can't predict the future. But really what we want to do is not wait all the time. We want to take the information that we have, and we want to use it to proactively look at who's driving crime, and is there a better way to police that and or prosecute that. So that is what we are trying to do with this new initiative, which we call the Prosecution Law Enforcement Unified Strategy Plus, is another acronym for what we're trying to do. So I am in charge of that unit. That unit includes a prosecutor from our human trafficking team, because more and more what you'll realize now is these violent criminals, particularly gang members, they're getting out of the drug business, they're getting into the human trafficking business. It's happening all the time. So the human trafficking component of our office is part of our team. The TriMet neighborhood deputy is a part of our team. We have a experienced deputy district attorney who is part of our team that handles most of our violent crime. The Gresham deputy district attorney is a part of our team. So we are very broad-based in our office, and yet focused in this area, trying to reduce this crime. And we have already got several cases that we've begun to prosecute based upon the work that we've done already. Now we have a lot of work to do. We are really, frankly, just moving in the direction of gathering our statistics and working with our law enforcement partners to put these two together. But in the meantime, we are focusing hard on the cases that are happening here. I've also begun partnering with the Gresham Police Department has an excellent neighborhood enforcement team, and the Gresham Police Department recently has reauthorized person in charge status at many of the apartment complexes, because we know that there's been a fair amount of violent crime in and around those apartment complexes, and having police officers as persons in charge there is very important to us. So at the same time that we're working on certain more serious players in the criminal field and drivers of crime, we are also looking at the places where they go to commit that crime and seeing how we can better improve our screening processes and safety at those apartment complexes. The city of Gresham, city manager Eric Varsons here, has been an excellent partner with us, as has the Gresham Police Bureau, Chief Junger. They've got very good police officers out here, and we are doing all we can to work with them. And I think it's going to be a partnership that's going to be very effective going forward. What I don't want to do is rush it. We have work to do, and we want to do it the right way. And I think if we do it the right way, we can make a difference out here. So I'm excited about that. Thank you.
Good afternoon and Happy New Year. My name is Rebecca Stavengard. I work with the county's health department, and I have the honor of being on loan for the Promise Zone designation process that we just recently completed at the end of November. So I'm here today to talk with you a little bit about what the Promise Zone is and to give you a couple examples of the things that we're looking forward to in the new year. Promise Zone is a federal designation that's intended to increase investment in communities to create jobs, to leverage private investment, to increase economic activity, expand educational opportunities, and reduce violent crime. And the eligibility requirements include things like high rates of poverty, serious and violent crime, unemployment, long-term vacancy, as well as, on the opposite end of the spectrum, the serious demonstrated commitment from all of the different jurisdictions that overlap with a designated Promise Zone. So in Rockwood, There are 3 census tracts that present not only this unique combination of risk, but also opportunity. And in November, we were pleased to be able to build on existing partnerships and collaboration in that area and submit an application for the federal designation for Promise Zone. There are 4 areas that are defined by the federal government for an application for Promise Zone designation. Those include strategies around crime prevention, increasing jobs, increasing educational opportunities, and economic development for the area. And then in addition to those 4 areas, we elected locally to add 2 additional topic groups, and those encompasses challenges faced around issues of health and wellness, and then also around issues of infrastructure. And if you know the Rockwood area, you know that those are definitely issues that are of concern for people who live out there, and those of us who have lived and done work in East County. The process itself reflected a really amazing collaboration and I think demonstrated the connectedness that we know exists in East County. We brought together, and this was a very accelerated process. And those of you, yes, I hear some chuckles. Those of you in the room who were part of it. We brought together approximately 150 community partners and identified 25 implementation partners that participated in determining and prioritizing strategies for each of those 6 topic areas. In the process of developing the application, we not only identified those priorities and strategies in the 6 areas, but demonstrated a leverage of about $30 million and that's direct dollars and in-kind partnership for the application. As I mentioned, this is an accelerated process, but I think that level of involvement, really for those of you who know the area, is really just kind of the tip of the iceberg. There are a number of organizations and partnerships that still need to be brought to the table, and we're excited to build on this work as we move into the new year. So we will hear about the status of the application in the coming months. And even if we do not receive the federal designation, I know that there's commitment between the county and the city to move forward with this work and move in the direction of developing those new and existing investments. So I wanted to share with you a couple of examples because through that whole process, while it was a whirlwind of community meetings and conversations with partners, I had the opportunity to participate in all 6 of those community groups. And so we had stakeholders from school districts to the chamber to nonprofit community-based organizational partners and many of our county departments that were represented at the table. And so I wanted to just share with you a couple of things that came out of those conversations. In the education work group, I'm really proud to say that we were able to have representation from all of the East County school districts. And if you have worked with school districts, and I know Centennial at least is in the room, right? Gotcha. They have a really amazing network and collaboration, the East County districts. And if one of them is involved in something, then all of them is involved in something. And we saw that that was the truth in this process. So what came out of the education discussion is some conversation about expanding our SUN service system to North Gresham High School. SUN service system, if you're familiar with that network, is also interested in expanding support for children and families through the Home for Everyone initiative. They're doing further integration of school-based mental health. There's some exciting work around school-based violence prevention for youth that are experiencing risk factors, especially sexual minority youth. And there are some really amazing efforts around addressing disproportionate discipline, which means the rate at which students are excluded through suspension or expulsion from school. And that's a disproportionate rate for students of color across the county. So they're looking at expanding the use of restorative practices in all of the SUN community schools that are within the Promise Zone. So I think that's some really exciting outcomes. And also represented in the education work group was the library, and I know that Sean is here. Hi, Sean. And the library has a really exciting expansion to their Rockwood branch. They're building a maker center. for that location. And so we're looking at some collaboration through the Promise Zone designation and then across other county departments in that area as well. And that's really going to help develop some skills in vocational training. And I don't know where I'm at with my 6 minutes, but I'll leave you with some examples from the health and the crime subgroups. And so these groups have a unique intersection with the work that I do within the health department, which is actually another federal investment. I coordinate a federal demonstration site that's supported by the Centers for Disease Control and Prevention. And the idea is to bring community partners and the health department together around a conversation about what violence prevention looks like, or violence before it starts. So looking at the effects of trauma and exposure to violence in the communities. And this is an example of how we've been able to leverage a federal investment and be able to expand that into East County, because that was a grant that started out in northeast Portland in the Albina community that Jim referenced. And we've been able, through partnership, to expand that countywide. So I'm really excited to see some of these things move forward in the new year, and then we will, of course, loop back with all of you should we get the designation. Thank you.
Good afternoon. My name is Joe McFerrin, President and CEO of Portland OIC and Rosemary Anderson High School. I'm honored to be here today with this panel to share a little bit of our work with you. Here today, I'm here to talk about what we're doing in partnership with a number of organizations around reducing ethnic disparities in the juvenile justice system. This came about, I would say, through the leadership of Christina McMahon, who was the Director of Juvenile Justice Services in Multnomah County. Her and I were talking maybe 2.5 years ago. She was sharing some data with me, and it was astonishing to me that African American youth were going to the juvenile justice system at a rate at 5 times that of Caucasian youth. I just thought that was a tragic situation. It was something that I wanted to get involved with and do something about. Not just for the sake of helping black kids, but for the sake of building stronger communities and helping all kids. And so Christina, she got the ball rolling, and she said, hey, we have an opportunity to go to Georgetown and put together a capstone project. And so we did that. And we took a pretty powerful group. It was Christina, Lorena Campbell, Multnomah County East School Districts, Brian Detman from the county, Lieutenant Tasha Hager from Portland Police, Judge Maureen McKnight, Carvin Rubio, Executive Director at Latino Network, Commissioner Shipwreck, and Charlene Woods, Chief Deputy District Attorney. So we had an array of professionals that have participated in this capstone project. And so what has come out of this is that historically what has happened when youth commit low-level crimes, juvenile justice would send out what they call a warning letter. And the warning letter just simply said, don't ever do that again. If you do it again, we're going to do something about it. As we looked at the research and the data, what we noticed is that youth that ended up in the deeper end of the system, OYA, incarcerated, a large proportionate number of those youth received multiple warning letters. And so we decided to figure out what we might do throughout the community to provide some sort of early intervention for youth when they get some sort of contact the first time. So these low-level crimes like stealing a candy bar from a store, or maybe having a half a joint of marijuana or skipping school. And so we worked together to try to figure out what could we do? Could we do something that might deter, redirect these young people so that they don't end up in the deep end? And so I'm happy to announce that in partnership with a number of law enforcement agencies throughout the county, Multnomah County, and nonprofit organizations, including Latino Network, we're going to be working with law enforcement in Gresham to work with those kids the first time they get in trouble. And what we're going to do is activate the community. I truly believe that the reason that many of these young people are committing these kinds of crimes because there's a lack of social, positive social activities to participate in, and a lack of connection to the community. So, starting this month, we're going to look at serving about 100 students or young people over the next 6 months, and we're going to, first thing we're going to do when they're referred to us, we're going to do a risk assessment. We're going to work with their families, and then we're going to try to connect them to agencies and support networks in the community. And we believe that light touch, we believe that this minimum investment will go a long way to redirecting our young people and putting them on a path to success. One of the things that I'm really excited about is the fact that as we've moved out to Gresham, we've been welcomed by all school districts and all the public agencies. So I believe that all of us working together can really make an impact on reducing ethnic disparities, giving our young people an opportunity to self-correct and to be positive, contributing members of our society. And again, we are going to work with all the school districts. We're going to work with community organizations. We have the Boys and Girls Club here today. We're going to work with our local workforce board and anyone that we can to give these young people an opportunity and put them on a path to success. Thank you.
Good afternoon. My name is David Hidalgo, and I am the director for Multnomah County's Mental Health and Addiction Services Division. And I'm also very pleased to be talking to you today because mental health and addictions is part of the conversation we should be having. I'm also very thankful and appreciative of Chair Kafoury to have a chair that says the word mental health and really has that one of her priorities. What I really appreciate about her as well is she's very tuned into the fact that healthy minds mean healthy communities. So thank you very much. I appreciate that support. In terms of what the county's role is in mental health and addictions in our community, what I thought would be helpful is to outline a bit so people understand where the county intersects with the community-based system. So the county's role really is twofold in the mental health and addiction system. We are on one side the local mental health authority. That's a designation provided by the state to all 36 counties across the state. Under that designation, the county is responsible for building infrastructure, funding, and overseeing an infrastructure of services that is accessible to all residents of our county. Services that fall under the local mental health authority designation are services you might find similar to a utility. Things like crisis services. Crisis services are required by all counties who have a local mental health authority designation to provide 24 hours a day. So for example, in Multnomah County, we have a very robust system of crisis services, which include the mental health call center, that is the local mental health crisis line. This past year, we accepted approximately 70,000 calls across this community. The phone number, just in case you have your pens out, is 503-988-4888. That is probably the singular number that you can provide to anybody in this community to ask a question about mental health or to get access to services within the public system and the contracted system that the county oversees. The other crisis services associated with that mental health call center line is mobile mental health outreach. We have a specific dedicated team in East County to serve East County's needs. Those are mental health clinicians who can travel across the county to wherever a Multnomah County resident is in need for face-to-face contact. The other service we have connected is an urgent walk-in clinic. So the county funds a mental health urgent walk-in clinic, very similar to a medical urgent walk-in clinic, where individuals can go and have an assessment face-to-face, meet with a psychiatrist or prescriber, nurse practitioner, to get some initial idea of what might be the next steps to assist in a mental health crisis or to assist a family addressing a need in mental health. So the crisis system falls very clearly underneath the local mental health authority designation. One of the other programs also is school-based mental health services. So that's been referenced by a couple of the speakers already. In terms of our school-based mental health program, the county funds clinicians that are located across school districts, and specifically in East County. We're in 29 specific schools and connected to all school districts. In those schools, once again, I think as Joe mentioned, the theme of prevention, early identification, and early screening really comes into play with these type of programs. So the clinicians in these programs work with teachers, work with other school staff, receive referrals for individuals that are at high risk, as well as do some initial counseling. May also connect with family, as we know that children often have other issues that really are emblematic of family issues that need to be addressed as well. So if there's a short-term need, the school-based mental health program will address that need and help stabilize, get the child and family to support. If it's a longer-term need, then generally the clinicians will refer out to some of the local programs. Some of the contracted programs that you may know by name or you perhaps have had some interaction. LifeWorks Northwest is one of the programs out in East County, Morrison Center, Trillium, Volunteers of America in terms of addiction services, CODA in terms of addiction services as well. And additionally, the school-based mental health clinicians are also co-located in the 3 school-based health clinics that are out also in East County. So a very nice collaboration in terms of integrated services where there are medical services through the county and then also within schools. The other role that the county plays is the county is a mental health insurance program for Medicaid. So many of you may know over the past couple of years, the governor has pushed this state forward with great leadership into a new model of health care. The organizations that lift it up are known as coordinated care organizations. There are 2 in Multnomah County. One is Health Share of Oregon. The second is Family Care. Multnomah County historically, and many counties historically, have had a role in the mental health system of managing the mental health Medicaid benefit. And partly because the counties had the experience already as a local mental health authority, and so we were able to leverage the infrastructure and services and then bring the funding for Medicaid plus the dollars that come for local mental health authority. The membership with the Affordable Care Act expansion is approximately at 130,000 individuals under the Medicaid plan currently. And of those individuals, approximately 25% of our membership resides in East County. So once again, it's essential that we have contracted providers and contracted mental health and addictions agencies that sit in neighborhoods where individuals live, where it is accessible for them to get access to services. And Chair Kafoury mentioned one of her priorities is access to mental health services. One of the focuses in our division is to ensure that we are addressing, number one, just basic access to mental health services with such an influx of individuals into the mental health and addiction system, but also that we really are addressing at the same time the health inequities and disparities for our communities of color that we know exist. The conversation for mental health is, as I said, a conversation that we all need to be having as a community many communities respond to that conversation differently. So it's important as we continue to look at addressing the mental health needs of the entire community that we have bridges built with leaders and communities across all of our culturally specific communities to address those needs as well. In terms of other goals and really kind of effectiveness of the mental health and addiction system, we tend to align with another concept that the governor has put forward, which really is the triple aim of healthcare. So that triple aim is a very concise kind of goal orientation for us to achieve to have an effective system. And that's better health, better care at a lower cost. So better health really means that we are focused on outcomes and that the system of services is tracked via outcomes. Better care, really having better satisfaction for the services, and that's really from the front door the moment somebody calls an agency or attempts to get into service, that it's easy, that the process is not traumatic, that the process is welcoming. And a lower cost, that part really is inclusive of ensuring that the treatments that the county purchases through the contracted network are effective, that the outcomes are good, and that through that the cost is actually also efficient. So I think that what's important, of course, is to ensure that people know where to call, where to get access to services. So once again, that mental health call center number really is the front door to the public mental health system to get access. The other thing, just in terms of the system of services, the county operates an open access system. So that means there is no right door. All doors are the right door. So people get referred through many of our social service partners or other agencies. May come through law enforcement, may come through hospitals, may come through schools, may come through Home Forward, may come through many venues in the community that we link with on a regular basis to ensure individuals who have contact with people who are at risk can make referrals and ensure people get access to care. One of the last things I would like to mention is really the county's push forward in terms of suicide prevention. Suicide, a national issue certainly for us to address. Here locally and in this state, Oregon has had a higher than average suicide rate for several decades. So it's a very significant issue for us. It's a public health issue for us to address. And so working directly with our public health department on some of the prevention work that they do will be a good way for the county to tie these efforts together. Over the past 2 years, the county has lifted a nationally best practice model known as Mental Health First Aid. And that program is an educational program. It's a day-long program. It's available to any resident of Multnomah County free of charge. It's currently being funded through the Board of County Commissioners. Last year, we trained approximately 500 individuals in this community. And what that program does is really raises the mental health literacy of our community together so that people understand what is mental health, what does it look like, how would you know if somebody's at risk, how would you know if a teen's at risk, how would you know if there's an adult that you're talking to in your daily life or your work or your family that they may have something going on, how would you ask a question, and once you get through that part, where would you be able to refer them? So that course actually really arms community members with knowledge that most people want to have. They often just don't have the information for that.
Thank you.
Yes, perfect. Excellent. So mental health first aid, the thing that I'll say is you are all welcome to register for mental health first aid as well. And if you have any questions about how to do that, please let me know or Chair Kafoury. Thank you.
Last but not least.
Hi, I'm Joanne Fuller, and I'm the county's health department director, and I'm going to be very brief. You've heard about a lot of great things the county does, and I want to give you a chance to ask us all questions. So I just want to tell you really briefly, the county runs the largest network of clinics that are designed to serve people who are uninsured and people who are insured under the Oregon Health Plan in the state. So we have 7 clinics that we run. They're integrated clinics. They provide pharmacy, lab, dental, and primary care for people who are seeking care who are covered under the Oregon Health Plan and who are uninsured. And they're really designed to be the safety net to make sure that people who need basic services are able to get them in our community. In addition to that, we run a network of 13 school-based health centers, which are designed to create easy access for kids to care without a lot of questions and without a lot of barriers, so that if they've got concerns about their health, they can really seek out someone. And as David said, many of those clinics also have a mental health professional there as well. And we're very excited that at Centennial High School, we just recently opened a new health clinic with a dental chair. So it's the first of our school-based health clinics that's offering kind of free, easy access dental care. And we're very, very excited about that. But in addition to that clinical system, which is incredibly important to our community, we are the public health entity for the community. And what that means is that if you think about the clinic system as the individual, as the patient, in the public health system, it's the population of people in the whole community that are the patient. So in that role, it's our responsibility to help ensure that there's clean air, that there's clean water, that you have restaurants to eat in that are safe, that things like rats and mosquitoes and other pesky things that are going to bring disease into our community are well controlled, and that people have access to healthy food and healthy environments. The chair talked about our current concern about e-cigarettes. If you've been reading the paper, the New York Times has talked about it, the internet has had several really important articles about studies. Basically, it's incredibly shocking that we have had the proliferation of a product that has very little regulation and control. We have no regulation over the substances that are in the devices, and complete and easy access for all of our kids to a product that when it's in the form of smoked as cigarettes and tobacco, we have strict regulation about both the product and the access. So you're going to be hearing a lot more about that. That's a huge public health issue that people are paying attention to in our community. And in addition to that, you're also going to be hearing about our work around communicable disease. So everyone remembers the Ebola scare. So in responding to communicable diseases, the health department is on the front line. We employ a group of physicians and nurses who basically are responsible for monitoring people who are identified as having significantly communicable diseases. We're seeing more and more. I mean, Ebola was kind of the thing that made the headlines, but there's a lot of other things that are going on in the world where our vulnerability to diseases and the internationalness of access to people and travel is making it so that it's harder and harder for us to make sure that we're creating that barrier to those diseases impacting all of us. So that's a quick, in a nutshell, what public health is and what we do. And I just want to give you time for questions. Thank you very much.
Thank you. I think you can see why I wanted to bring this distinguished panel along with me. We have some really excellent folks who are working in our community, and I think hearing from their own mouths about what's going on is sometimes more effective than hearing from me. But I'm really happy to answer any questions that you have. You can direct the questions towards me or any of our panel today. They do need to walk up to the microphone to answer questions if they're directed at you, because it's a TV lab. So any questions from our folks?
So welcome again. Is this on?
Should be. Yep.
Would you comment a little bit about the adequacy of mental health beds in the county? And if they're not adequate, what's being done to try to increase the number of beds?
Sure, I could probably, David, would you like to start with that question?
Sure. When you say beds,
for more than just an overnight stay.
Yeah, so there's, in the system of care for psychiatric services, there really is a hierarchy of care. So if you think at the very top, inpatient psychiatric beds, facility-based, then there are subacute programs just below a hospital level of care, and then residential group home type services. One of the things I would say that there's a lot of information that you will hear around the need for beds. What we do need is housing. We need a place not for somebody to land overnight or for 2 nights. We need people to have longer term housing, supported transitional housing. If we have those, that spectrum of housing available, I think we would find that the access to inpatient psychiatric and other services would be quite adequate. So, you know, when you think about a system of care, if one of those parts of the system isn't propped up to provide that, you will start to see it in other areas. So I would say the focus really is looking at housing.
I was worried about health. I had a question about healthcare. I'm just wondering what changes in healthcare and Affordable Health Care Act and outcomes-based healthcare, what the challenges are with the county, because it seems like that might be different than, you know, private practice.
Good question.
Do you want me to please talk about that?
I'm sorry, can you repeat the question?
Sure. So the question is about what the impact has been about the changes in healthcare on the county. So the Affordable Care Act has created both opportunities and fantastic challenges for the county. Those of you who have been following the story know that within the first 6 months of the sign up for people under the Affordable Care Act, the Oregon Health Plan was basically to the level that we had expected to get 3 years into the implementation of the Affordable Care Act. So what that means is that way more people got signed up for insurance than we expected was going to happen. That's fantastic, right? Because that means that people now have insurance, now have coverage. The challenge is we didn't manufacture that many more doctors in the community, right? So figuring out how to create access to care for those people, and especially figuring out who really needs care, has been one of the big challenges that we've had. And part of the concept of the Affordable Care Act is not just that you provide the same old care to all of those people, but that we actually change care. And we talked about the fact that we're judged on metrics. And we actually have been moving for the last few years before healthcare reform to a new model, which is team-based care, which means that you don't just see the doctor. If you need the level of care that a physician's assistant can provide, or if a consulting nurse can provide care to you, you get to see that person instead of seeing the highest level professional that may be working sort of underneath their maximum capacity and doing everything for people. That is allowing us actually to meet the metrics that have been put out there, and to create more access to care for people, because you don't have to sign everybody up to see the doctor or the nurse practitioner. They can see various different people. As we move forward with the implementation of the Affordable Care Act, 2 things happen. One is the way that we get funded gets more flexible, which allows us to do even more of that kind of flexible care and do things like create electronic patient information access. Many of you probably have that. I know I have it with my doctor, where I can kind of go in and look at my chart on the electronic portal, safe electronic portal. We're creating that for patients in our system to be able to do that as well, and ways to outreach to people, to not just wait for people to come to us and say, oh gee, what can I do about my high blood pressure? But if we know someone has high blood pressure, we can be reaching out to them and proactively engaging them in controlling chronic disease, for example. So those are the kinds of things that are happening, and they're very exciting and also really challenging, because we've got a lot more people who are demanding the service than we have the staff at this point to do. So we're working on that access as fast as we possibly can. Thank you.
Go ahead.
Well, I had a couple of questions, but I'll start with what I think is probably the more difficult one. There's been a lot in the last year or two really about mental health and interaction with police. So my question is, how is the county's mental health, and are they working with sheriff and police departments and training? So I'd like to hear a little bit about what might be or not be happening there.
Sure, I'll start a little bit with this question, then the professionals can take it over. The question is about the interaction with people who are experiencing mental illness and law enforcement. And we have done a whole bunch of things in Multnomah County recently around this area, and one of them is we've put more professionals in the jails who have a mental health background so that we aren't expecting our sheriff's deputies to have the training. I mean, we can do training, we do a lot of training, but that's only going to get you so far. Training every law enforcement to be a mental health professional is not as successful as having mental health professionals help folks. We've also opened up more beds at the CATC, it's the Crisis Assessment and Treatment Center, which is located in inner southeast Portland. And that's a place where people can stay up to 2 weeks if they're experiencing severe crisis in mental health. And we have 2 beds reserved for people who come in contact with the criminal justice system, but really should not be in jail, they should be getting treatment. So those are 2 areas in particular that we focused on. Are there some other areas that I'm missing?
I think that's terrific.
Okay. But it's not only a huge cost to us as taxpayers because you have people who are staying for a long period of time in jail, but it's not helpful it's dangerous for our law enforcement, and it's not helpful for the people who are experiencing crisis, because obviously jail is not the place where they should be. They should be in treatment. Did you have another question?
Oh, we'll let Brian
Okay.
is first.
Hi, Brian.
Good afternoon. It's nice to see you. This question is along the lines of law enforcement, and so maybe I'll direct it to the district attorney. A couple of years ago, I was on jury duty, and while I was waiting to be called in to court, I was talking to the deputy sheriff who was there to testify against a person that he'd arrested. This guy'd been arrested, I think this was his 4th time, for grand theft auto, identity theft, drug dealing. I mean, he was a bad guy. But recurringly, he kept getting convicted, going to jail, and getting out. More recently, speaking with my work with Home Forward, speaking with the liaison police officer from Gresham, who's just a wonderful police officer and has done a tremendous job in community policing here in Gresham, and I think many can attest to that. But he said, hey, we know who these bad guys are. We know who the heads of these gangs are. They go to jail and they get back out. And I'm curious, this is a question, what needs to be done in the court system in order to put these guys away so they don't come back out and recreate crime and recreate a network of crime in our community?
So that's a big question. And I guess I would respond, I think I want to answer your question a couple of ways, because you use both examples of auto theft and identity theft, and the person who was in the revolving door process, and then also the leaders of the gangs. And usually, they're not committing identity theft and auto theft as much as they're committing human trafficking and violent crimes. I think the best way I can put it is, more and more you are going to see the property offenders being released back into the community and being supervised. Hopefully that will be done well, because the jail and the prisons are going to be reserved more and more for violent offenders. You could dispute that. I think the reality is we have a limited number of both jail beds and prison beds, and Senate Bill 3194 and the Multnomah County Justice Reinvestment is an effort to be smart about who we are going to use our jail and particularly more importantly, prison beds against. And so your question is a very good one in that it's hitting upon a conversation that everybody in the county and across the state is having right now, and that is who should be going to prison and who should be serving long jail sentences, and are we getting the right people? I think we're being smarter about it. I don't know if we have been successful yet, but I think we're thinking about it, and I think we're getting smart about it because we're now looking at these offenders individually and trying to make informed decisions about, is this person someone who should be in prison? And is that where we want to use our resources? Now, that said, that's kind of a global answer. On a more local level, yeah, the jail definitely is going to release people on. I don't run those matrices, and I don't think we've had any recent matrix releases. But more and more, the jail is going to put its resources into more violent people. What we are trying to do in this area is focus on the drivers of violent crime, and I think we'll get to the heads of the gangs if we do focus on the drivers of violent crime. I think the officers you're talking about, I know those officers, they're excellent police officers, and Betty knows those officers. And by trying, you're going to see some benefit now that particularly Gresham is using person in charge status again at these apartment complexes. And those officers, knowing how to do that, and they're being, and this may sound mamby-pamby, but I'm telling you, they're being educated in SEPTED principles, and these officers that you're talking about, I think it's one of the greatest things they've ever learned. We will accomplish a lot by paying attention to the basics out here. And some of the basics are we've got to clean up these apartment complexes. And that doesn't mean just go in and try to grab the violent criminals that may be in there. It means, or their girlfriends or whomever, it means let's clean it up, let's make it look better. Let's make sure we pay attention to who we're into and that we follow the rules, and if anybody's violating those rules in the apartment complexes, that they need to be removed from these apartment complexes and moved somewhere else. We meet Home Forward on a regular basis. They're very good stewards of apartment complexes out here. We want everyone to engage in this. In fact, we're talking with the city of Gresham. I have a meeting coming up in a couple of weeks about trying to make a more robust process along these lines. So I think everyone's taking that pretty seriously. I hope I'm answering your question.
Well, I think it's a tough question.
It's a tough question, and I think that's the best thing to
Easy
do
ones for somebody
today.
else.
Yeah.
Oh, sorry. We know that the rate of poverty has gone up in East Multnomah County, particularly in the Rockwood area. So if you look at the other side of that, what is the coordinated kind of attempt to bring more prosperity to the East Multnomah County, to the Gresham area, particularly to try to ensure that kids who are living in poverty don't grow up and repeat intergenerational poverty?
Another really easy question. The question is about poverty and intergenerational poverty. I think I have noticed since I've been on the Multnomah County Commission, which has been almost 6 years now, a dramatic change in, people talk about the increase in poverty in the Rockwood area. It really has. In government terms, it's come about in some ways overnight. It's been very, very dramatic. And one of the areas that I'm really hopeful about is this Promise Zone. I know it sounds a little odd to be talking about an application being such a great event, but it really was, I think, the first time that we put a stake in the ground that we as elected leaders, as community leaders, as business leaders are going to focus our energy on this particular area. And so the process by which we came together to put together that application, really putting 150 stakeholders around various tables, committing to this area is going to make, it's going to make a difference. And I know that you'll see some changes from, my budget is going to be coming out in the next few months, and there will be some money behind those commitments. I know that Gresham Mayor is committed as well, and I think that you'll see some significant in that area. There's no easy answer, there's no silver bullet. I personally go back to housing as being a huge emphasis for me, and thinking that when we have children who are moving around with their families over and over again, we can only do so much through the school system. If they're moving from school to school, they're not going to get the education they need. They're not going to build the community and have the community supports that we heard Joe talk about. So if we can have safe, stable housing for people, that's definitely, I think, the foundation for building a more successful tomorrow.
Thank you for being here. So we're going to experiment with legalized pot in Oregon. And my question is whether the DA's office has a strategy for dealing with driving under the influence, and whether Washington and Colorado have led to really advancements in testing, roadside testing for driving under the influence of pot.
Well, I guess the easy answer is I haven't been involved in discussions about strategies regarding DUI and marijuana. Personally, I don't know why it's going to change. It's illegal now. It will be illegal when Measure 91 takes effect. And frankly, our office, as you all may know, is treating Measure 91 as though it's in effect now. So and I hope I'm not trying to dodge the question, but I think the simple answer for me is we're going to treat it just like we always have. We don't get a lot of those cases, quite honestly, but when we do, we have each law enforcement agency, whether it's Gresham or Portland, has drug recognition experts, and they're very good at what they do, and they can get down to what type of drug the person is on. I don't know about the other states. I can't tell you about that. So I think our strategy is we are going to go forward as we have in the past, because it's not broken and we're not going to try to fix it, is where we're at.
Any more questions? Time for one more. If anybody has. Okay, Neil, you're the last one.
Well, in regards to the marijuana industry, what is the county doing to look at controlling the growth and the impact of that and the benefit of it?
What's it?
Growth of the plant?
Yeah.
The plan, not the plant. Excellent.
Marijuana question. I think we're really looking for the state to take a leadership role in this. The measure that's passed has put a lot of emphasis on states as taking local control really out of the picture. I do know that we work very closely with addictions programs, and that's the area that and prevention programs to get kids active in school so that they're not tempted by this now legal, soon to be legal drug, drug. But I think that in terms of controlling the growth or the harvesting and that kind of stuff is really it's a state function. And, Senator Ginny Burdick and State Representative Ann Leininger will have a fun time this session co-chairing that committee in the legislature.
Very good.
I just want to say thank you again for having us today, and I am happy to come back to talk with you or any of the other organizations that you're involved in. You can see we have a wealth of expertise at the county, and we are more than happy to help you in any way that we can, answer questions or come talk about things. I know there's been a lot of topics that we've touched on briefly today that could have a full session just about that one topic, so we're happy to come back and talk more in the future.
Thank you very much. On behalf of the Chamber, we thank you, Deborah, and we thank you, panel members who've all come to share with us today. We hope that your thoughts have been stimulated with some of these important topics, and that as we go forth from here, when you have questions or concerns, there are some people up here that you've now met that you'll be able to get in contact with to pursue that discussion further. But thank you for being here today. On your tabletop is an evaluation form that was placed there. That's not just a placemat for your dinner. We hope that you would take just a moment to complete that and leave it on the table. We will collect them after you're dismissed. So again, our thanks to you for being here, and look forward to next month to another interesting government forum that Warner Allen will have prepared for us at this committee. You're on the spot, Warner. Thank you and good day, folks.